Chicken is considered one of the healthiest proteins out there, and in most cases, it really is. But there is a truth that almost nobody talks about, and that cardiovascular health specialists have known for quite some time. Certain parts of the chicken, especially after the age of 50, do more harm than good. And the problem is not the chicken itself. It is where the fat accumulates. It is where the toxins are deposited. It is where the residues stay. And you are probably eating these parts regularly without knowing what they are doing to your arteries. Today I am going to show you exactly which 4 parts these are, why they are dangerous, and what to eat instead. And before we get to the 4th one, I need you to pay close attention because it is the one that surprises people the most and probably the last one you would expect. But before we continue, tell me something in the comments. Do you eat chicken every week? How often? That kind of information really helps understand how relevant this topic might be for you. My name is Klaus Hoffman. For years, I have dedicated myself to studying how nutrition affects the cardiovascular system in adults over 50, and everything you are about to see is based on real evidence published by institutions like the American Heart Association and the National Institutes of Health. If you are not yet subscribed to this channel, subscribe now. There is a lot of content like this that can make a real difference in your health. The first part that needs to leave your plate is the skin, and I know it is the most delicious part. Crispy, flavorful, hard to resist. But that is exactly where the problem hides. Chicken skin stores fat in quantities far greater than the rest of the bird. According to the National Institutes of Health, keeping the skin on your meal can triple the amount of saturated fat you consume compared to skinless breast. For a body over 50, whose arteries have already lost part of their natural elasticity, that excess saturated fat is a direct invitation for plaque buildup. But that is not all. When the skin is fried or grilled at high temperatures, it releases compounds called AGEs, advanced glycation end products. The Mayo Clinic has documented that these compounds accelerate the aging of blood vessels, increasing arterial stiffness and the risk of cardiovascular events. In other words, fried skin does not just add fat. It literally ages your arteries from the inside. And this process is silent. You do not feel it. It does not hurt. It happens slowly, meal after meal, until the damage is already done. The second part is the liver. And here the problem is different, but equally serious. The liver is a filter organ. Its job, both in humans and in chickens, is to process and neutralize toxic substances circulating through the body, which means it accumulates what it cannot eliminate. Heavy metals like cadmium and lead, medication residues, environmental toxins. All of this tends to concentrate in the liver. And when you eat that organ, you are also ingesting everything it retained. On top of that, a single serving of chicken liver contains more than 300 milligrams of cholesterol. The American Medical Association confirms that this number exceeds the daily recommendation for adults with a history of high cholesterol. For those who already have a predisposition to cardiovascular problems, a single meal with liver can be enough to throw those levels off balance and increase the risk of arterial blockage. It is not a forbidden food for everyone, but for anyone over 50 who monitors their heart health, it is a choice that demands real caution. The third part is the neck. This is one of the most commonly used cuts in broths, soups, and stews, especially because it gives an intense flavor to the liquid. And that is exactly why most people never suspect the problem it carries. Chicken neck has a very high concentration of fat and purines. Purines are natural compounds that, when metabolized by the body, are converted into uric acid. And elevated uric acid is not just the villain behind gout. The European Society of Cardiology links high uric acid levels to an increased risk of hypertension and cardiovascular disease. In other words, that broth that seems comforting and nutritious may be silently putting pressure on your arteries. And there is another point that very few people consider. When you boil the neck to make a broth, much of the fat dissolves into the liquid. That layer floating on the surface, which many people simply ignore or stir back in, is exactly where the saturated fats and some of the fat-soluble toxins the bird accumulated during its life are concentrated. If you enjoy chicken broth, you can still make it safely. But the neck needs to stay out. And that layer of fat on the surface needs to be discarded before serving. That one detail makes a real difference. The fourth part, the one I said would surprise you, is the wingtip. It seems harmless. It is small, popular at parties and gatherings, and almost everyone eats it without a second thought. But the wing tip is, proportionally, one of the most problematic parts of the entire chicken. Around 60% of the calories in this part come from saturated fat, compared to less than 10% in the breast. That alone would be reason enough to avoid it. But the problem goes beyond the fat. In industrial chicken farming, antibiotic and vaccine injections are frequently administered in the wing area. The wing tip, being a region with poor circulation and dense cartilage, tends to concentrate residues from these substances. The journal Environmental Health published data showing that conventionally raised chickens present higher levels of chemical residues and antibiotic-resistant bacteria precisely in these peripheral regions. For the immune system and intestinal health of an adult over 50, that continuous exposure is not a trivial matter. An inflamed gut directly affects cardiovascular health. That connection is already well established in the medical literature, and there is a question that comes up often when this topic surfaces. What about organic chicken? Does it make a difference? Yes, it does. The environmental health research shows exactly that. Organic chickens, raised free-range and without routine antibiotic use, present fewer chemical residues. But keep in mind, this does not eliminate all the problems. The skin still accumulates fat. The liver is still a filter organ. The neck still has purines. What changes is the toxic load, not the structure of the problem. So choosing organic is an advantage, not a free pass to eat any part without criteria. Did you already know that the wing tip concentrates this type of residue? Most people have never heard of this. And this is exactly the kind of information that makes a difference in daily life, not just in the doctor's office. Leave a comment telling us if this changed anything about the way you see your plate. So what to do from here on? The answer is not to stop eating chicken. It is to eat chicken more intelligently. And that starts with choosing the right cut. Skinless breast is by far the safest option for cardiovascular health. Skinless thigh is also a good alternative, as long as it is prepared the right way. Harvard University reinforces that daily food choices have a direct and cumulative impact on long-term heart health. It is not one single meal that defines anything. It is the pattern. It is what you repeat week after week, month after month. The cooking method matters just as much as the cut. Boiled, baked at medium temperature, or simmered. These are the methods that preserve the protein without creating inflammatory compounds. Deep frying, especially with the skin on, is the most aggressive combination for blood vessels. It concentrates fat, generates ages, and adds empty calories that the body over 50 has an increasingly harder time processing. It does not have to be perfect, but it has to be consistent. If you enjoy seasonings, good news. Herbs like rosemary, turmeric, and garlic do not just improve the flavor. They have documented anti-inflammatory properties that help neutralize part of the oxidative impact of the meal. Small adjustments that, added together, make a real difference in arterial health over time. The American Heart Association recommends exactly this kind of approach, replacing problematic ingredients with functional alternatives without giving up the pleasure of eating well. And about chicken broth, which is a very common question. You can still make it, but carefully. Use clean bones, without skin and without the neck. During cooking, skim off the foam that rises to the surface in the first few minutes. At the end, discard the layer of fat floating on top before serving. With these adjustments, the broth loses much of its toxic load while keeping the collagen and minerals that make it a truly valuable food for joints and immunity. One last practical detail that cannot be overlooked. Never use the same cutting board for raw chicken and vegetables. Cross-contamination from salmonella is a real and preventable risk, and chicken needs to reach 165 degrees Fahrenheit internally to be safe. These 2 points may seem basic, but they account for a significant portion of food poisoning cases in adults. Kitchen safety is also part of taking care of your health. Chicken can and should remain part of your diet. But now you know what to avoid, why to avoid it, and how to prepare it in a way that works in favor of your heart, not against it. That is what separates a common food choice from a truly intelligent one. And after 50, that difference is worth a great deal. Did you already have the habit of removing the skin before eating? Or was the wing tip a guaranteed presence on your plate? Leave a comment. I want to know what your habits looked like before this video. If this content was useful to you, give it a like, share it with someone who needs to know this, and hit the bell so you do not miss what is coming next. Your health thanks every conscious choice you make today.